just love a spring wedding. There is absolutely nothing I enjoy more than getting to see my friends or my family or my colleagues celebrate their love on a nice spring day. It just fills my heart with joy. And I was at one just this weekend. And, for those of you who are listening to this podcast on a video, you can see the evidence of my weekend enjoyment. And one of the things that happened this time is that as we were celebrated, we chose to do it on a park. And I was sitting on a bench, and there's a puja ceremony at which point they asked us to take off our shoes, and I did, and I put my feet on the grass, and then I screamed and I shrieked because I am a wormophobe, which means I'm terrified of getting worms. And as a child, and I would have been about 5 or 6, one of my maternal aunts told me that if you put your feet on the grass barefoot, a worm will enter and it'll go all the way to your brain and it will stay there, and then it'll create a bump, and then you'll spend the rest of your life with a bump. Um, Now I know that she did that to keep me from walking barefoot on grass, but over the years I have been reading about worms, different types of them, and with each worm I get more and more phobic about it. And so you can just imagine what I have gone through when I discovered last month that there is a worm which can enter my system simply through the bite of a mosquito. This is Sonalia Charji, and you are listening to Health Wealth, a podcast that wants to bring to you factually accurate information about your health, but also to leave you feeling motivated and inspired to make the right choices for yourself. It's funny, but till I came to know that there is a worm that's passed on through mosquitoes, I was a bit of a mosquito vigilante in the sense that I came to know that there is a research lab, a government-owned research lab in Pondicherry that's been doing research on how to introduce a particular variety of mosquito into our environment, which is sterile, which means it can't reproduce. And, in the hopes that this mosquito will cause the females to lay sterile eggs and then end an entire generation of mosquitoes in this manner. And I was, of course, outraged, on behalf of the mosquitoes. And, I went so far as I told my tattoo artist that I want to get a mosquito just to, mark my protest against this sort of destruction of a species. But then I came to know that these mosquitoes are responsible for an incredibly painful disease, a disease that dramatically reduces the quality of life of those who are unfortunate enough to get it, a disease that causes myths and superstitions, which most of us wouldn't have heard of. Yet we would be able to sort of imagine it because the internet is full of people who have this disease. And it's known as elephantitis filiaris, or lymphatic filiaris. And you would be able to recognize this through those images of people whose feet are swollen up, gigantic feet that look like, elephant feet. And, I remember I had no idea what this disease was, how it was caused. I just knew that, it's grotesque, it's ugly. I would not want to see these images. I would not relate to what this person would be going through. I'm being very honest. I mean, judge me all you will, but that's exactly how I felt. It was icky. And so my mosquito vigilante has reduced a bit since then, but my wormophobia has increased, and I really wanted to do an episode where we talk about this worm and and how it causes this disease. And so I have with me today Dr. N K Ganguly, who was the former Director General of the Indian Council of Medical Research. He's also a microbiologist, And we'll get to a little bit more about, his work later on, but we have with him now. Thank you so much for coming today, sir.
Thank you, Sonali. And your mother was right, because if you walk barefoot,
Yeah,
you get a parasite infection, which also wanders around your skin and organs and causes severe anemia and allergy. That is
of
known as
course.
hookworm.
You
So,
should not tell children these things. It's created
so
a lifelong fear of worms in me.
So that is because of walking barefoot, because
Yes.
its larvae penetrates the skin and enters your body. And there is a Nectar americanus is one of the hookworms. So hookworm and Ankylostoma duodenalis. There are two kinds of hookworm. And your mother was right that it can enter brain also, which can enter through having unwashed salad. It comes from the pig. These are known as cysticercosis. So cysticercosis are passed through the tinea worms, and tinea worms can enter your brain and cause brain cyst. So your mother was right on both the counts. So
And
even
I am right then to be petrified of worms.
and a little bit about my other qualification. I was a professor in PGI Chandigarh, and there I was also professor of mycology, also professor of parasitology. So I worked on filariasis, and I also worked on leishmaniasis. So some of these uh, bugs which come under the NTD, the neglected tropical diseases, I used to do my research on them. And when I came as an ICMR DG, it enhanced, because most of these vector institutes were, including the VCRC, which you were talking about, came under our umbrella. And I chaired the ICMR. When I retired, I chaired the ICMR group for the elimination of filariasis accelerated, and also the group which is set up by the our vector vector control organization in our Ministry of Health. So I always had a front seat and was also in the WHO CRO committees, expert committees on this area. So it is a pleasure to inform you about whatever is the latest in these areas.
Yes. I think before we get to the latest, you've already talked about a few worms, but this elephantiasis is caused by one particular worm. So can you tell me about the filarial worm and how do they
Yeah,
spread?
yeah.
What do they
The
do?
the filarial worm, essentially there are three kind of filarial worm which are present in the Asia and Southeast Asia. One is known as Ucheraria bancrofti, which was discovered by Bancroft, and then there is a Brugia malai, which is there in the coastal areas much more, and like Kerala, Odisha, etc. These are the areas. And then there is one more which is not found in our country, but is found in Indonesia and Timor-Leste, which is known as Brugia timori. So these are the three major filarial worms which are prevalent in Southeast Asia. There are other filarial worms which are present in the African subcontinent, and in other subcontinents also, South America also,
Right,
they are
right.
there. But African subcontinent, there is a special one which is known as onchocercosis, and and another filarial like worm which is known as loa loa. So these are the families of the filarial worms which are
Right.
around the globe.
The only name I remember that you said is Lua Lua.
Yeah, loa loa affects the
It's very
eyes.
memorable.
It affects the eyes,
It's a very nice name, though.
but not in
How
India.
does the worm that causes elephantitis, how does it spread and, how does it actually cause this illness?
This is caused by a mosquito, which is known as Culex species, Culex vishnui. There are three major mosquitoes species which we should fear in our country. One is Aedes. You can identify these are These are big mosquitoes, which are called tiger mosquitoes. They're spotted. Then there is a Culex mosquito. Culex mosquito actually sits parallel to the surface wherever it sits. So any person can identify it. And the malaria mosquito, which is known as Anopheles mosquito. So there is a Anopheles mosquito sits at an angle with the walls, and they have different habitats. Some are anthrophilic, some are zoophilic. So, and they are some of them are night biters, some of the and the day biters, and most of the male mosquitoes uh, they like us, they drink fruit juices, but the female mosquitoes are the special ones who are blood suckers and who suck blood. So what happens that when the Culex mosquito it sucks the blood of a filaria infected person, it gets microfilariae, which are the children of the adult worm, which are circulating in the blood. And then it goes through different processes, L1 larvae, L2 larvae, L3 larvae, and it goes through its multiplication in the mosquito body, and then it comes into near the salivary gland. So when the mosquito bites another person, it releases the L3 larvae in the person, and this L3 larvae then finds its way in the lymphatic organs. So you need to understand what are the lymphatic organs. Lymph. We have a two circulation system. One is the blood and other is the lymph. And lymph and blood are very closely linked with each other. So here, these worms, they love to stay. The adult worms love to stay in the lymphatic system, and from there they produce microfilariae, which is the children, and then these circulate, and they circulate mostly in the night time, except in Andaman Nicobar, etc. There they can be in the daytime also. So this is the circulation pattern, and when they multiply over there, they cause severe, because there is a lymph, they cause inflammation, there is a lymph extravasation, and that actually promotes the multiplication of the tissues, and you get the flaps, and layers of flaps are produced during it takes several years of time into living in the endemic area to really gather elephantiasis. Otherwise, it is simple lymphangitis. And in some males who travel from an endemic area, from travel the first time to an endemic area, they get orchitis. And because of this lymph blockage, lymph is a very irritating thing. Lymph blockage, some males get hydrocele, and some ladies get it multiplies in the breast, and their breast gets very painful and swollen, and their genital organs. So this affects many organs. But elephantiasis is something which is very difficult, particularly when it goes to ladies. And ladies are more susceptible to filariasis than the males. I know because I was born in Eastern UP in Gorakhpur, and it was a filarial region. And in my own family, three ladies in my family had elephantiasis, and it was very difficult for them to get even married. So it has a very big psychological problem for people who have this disease. It
Yeah.
is not only.
You
It is
know,
not only.
I'm going to ask you something a little basic, based on what you just said, but just for the benefit of someone who might be like me, what is a lymph node?
Lymph node is as I told you, that we have a lymphatic circulation. Lymph nodes are there in they are in many vital areas, like they are in the arm, in the armpits, they are in the elbow area, they are in the neck area, they are in the knee area, they are all around. These lymph nodes have got are populated by different populations, such as lymphocytes.
Okay.
These are the blood cells, and they are the immune organ in our body. So whenever we get a foreign body or an infection or a cancer, these lymph nodes swell up.
Right.
And these lymph nodes are nourished through an intricate network of lymphatic vessels, where the lymph, which is very thick and which looks like a cream-like of thing, which circulates through the through these and takes these lymphocytes and others from blood to lymph nodes and other lymphoid organs. Other lymphoid organs are the spleen. They
Right.
also stay in the spleen. So
Right.
this circulation is there in our body, and this creates a homeostasis between the blood as well as the lymphoid organs, so that the blood and lymphoid organs have a homing pattern of the different cells traveling between them. But the lymph, which is very thick and is opaque, like looks like a creamy sauce, is very, very irritating. If this gets out and the
Yeah.
antigens of the filarial worm, adult filarial worm gets out, it causes a huge inflammation. And this inflammation then makes the flab and other tissues to multiply. So layers of tissues multiply, and you get the venous return, the lymphatic return becomes blocked, and you get the elephantiasis, which is also known as hathi paw in a
Yes.
very colloquial language.
Yes. Actually, I find it very endearing that you call a lymph node irritating, because I would do the same when, I have a pen that doesn't work and I'll say, oh, this is so irritating. And you seem to be connecting a lymph node in that
No,
manner,
no,
because
no,
that is
lymph.
your profession.
No, Sonali, lymph is irritating, not
Oh, the
irritant,
lymph is irritating.
but not
Sorry,
lymph node. Lymph
my
nodes are
mistake.
nodes which are our lifeline,
Okay,
because
so just the
because
lymph.
yeah, when you give vaccination, the immune cells which produce antibodies are in the lymph
Right,
nodes, lymphoid organs.
right.
So they are very, very important
Right.
in our life.
Now, you've mentioned we've just come to the point of elephantiasis, which I've just now discovered I've been pronouncing wrong, because I've been saying elephantitis, which it isn't. Um, what is the burden of this disease in India? And you've given a bit of a picture of what sort of life, somebody like with this condition would have. But,
So
could you complete the picture?
Currently about 120 million people around the world are suffering from lymphatic filariasis. About 40% of them live in India. So you could know the numbers. Many of them are less, but 1.7% of the all lymphatic filariasis are the elephantiasis. So it is not necessary that if you are suffering from filariasis, you may have symptoms. Very large number of them have no symptoms, but they can transmit the disease. And some of them have these, as I told you, orchitis, lymphangitis. They have this memory infection. Some of them have infection in the genital organs. So all of these, and some of them have hydrocele, which is in the scrotum sac, the accumulation of the fluids and the bloods. So this is how the whole system works, and it is not necessary that if you have a filariasis, you will have all these systems. Only a fraction of all the filariasis have elephantiasis. But they are so glaring that in the whole community, if you have two persons, they advertise the horror of filariasis. So
And
that
and
is a problem.
how
Aesthetic.
does one live with this condition? I mean, you must have seen a lot of patients with it. What were their lives like?
The life cycle is that once you have advanced filariasis, a very few things which could do to you may be cured of the disease, So even if you are cured of the disease, you will find that that this uh, elephantiasis still remains, and it may get infected and may cause a lot of problem. So there are certain things which have to be done, like this need to be detected very early when the lymphangitis is there, so that when you cure, there is no elephantiasis. Once elephantiasis happens, then you have to keep it very clean with soap and water and others, so that it doesn't get infected. Sometime, and you, of course, you will have to take the complete filarial treatment. And then after sometimes what you may have to do, that you may undergo some plastic surgery, several surgical manipulations to ultimately make you again aesthetically uh, better. But what happens that when these lymphatics get blocked, it is very difficult for to unblock them one by one, because many of them are very thin collaterals and very difficult to do that. So if you have gone up to advanced elephantiasis, which used to happen in olden days, but in today's world, it should never happen. In today's world, if somebody gets it, so we should have programs. Firstly, the preventive programs, which are not really treating programs, preventive programs.
Can you prevent it? Is it preventable?
Yeah, it is preventable by one of the things you yourself told, that the filarial worms, the sterile mosquito population, this is something which is not actually genetically manipulated there, because people have some problem with that. So there are many such interventions, but this is one intervention which is very, very good. Another intervention is known as Wolbachia. Wolbachia are particular organisms which remain with the filarial worms all the time. They're companion of filarial. So if you treat with doxycycline, Wolbachia die. And some Wolbachia can kill the mosquitoes also. So one of the VCRC major program, it was developed in Cairn for Aedes group of mosquito, but we know that it cuts across the mosquito species, where where these worms, infected mosquitoes, were released in high number. So they actually infected other mosquitoes, and the mosquito do not survive with the Wolbachia. But filarial worms, in their gut and system, they and Wolbachia live happily together. So
Yeah.
if you remove Wolbachia by an antibiotic, then filarial worm die. So this is something which we need to remember. The other thing is that there are impregnated mosquito nets which are now are impregnated with pyrethroids, the insecticides from the plants, which are very gentle, nice insecticides. These, if you sleep in them, then you don't get this particular bite.
Right.
And sometimes you get impregnated appearance if you are living in a very highly endemic area. There are systems which are known as environmental control. These are there that you don't allow water to accumulate. Look at the drains, look at the manhole where water accumulates. Look at all the systems where the mosquito could breed, and take care of these mosquitoes. And some of the mosquitoes, mosquito larvae which are in the surface, they could be eaten by the fish. So we call it integrated management of vectors, because for each vector you should not have different system. It becomes very, very expensive. So few of the methods which are taken are residual spraying, and using the power pump, so that some of the mosquitoes which are sticking on the walls, they are taken care of through the power pumps. We look at their habitats, and spray the habitats also. Some of these mosquitoes are in the vicinity of your house, and if you don't spray them, they will bite. So
Right.
essentially tracking the mosquitoes, looking at that mosquito parasite burden. There are some very good traps, sugar traps or light traps. You catch the mosquitoes in the traps. We call it xenodiagnosis. We then crush them up, and then with the modern PCR techniques or antibody techniques, you look at the number of the various parasites which these mosquitoes are harboring. And when you can identify that, you can know that in this area, firstly, mosquito numbers have increased. Secondly, that they have what parasite they are carrying out. In past, we didn't have these technologies. It was a very, very painful technology that you put your arm inside the cage where the mosquitoes are bred, and or into a trap, and the mosquito will bite you, and then you find out which species of mosquito are the biters, and then you go. It was so the new technologies are
Did you do that? Did you put your hand in and get bitten?
no. Now if you do, you will be arrested because there are much better technologies now.
But did you do that in your time?
Yeah, once when I was joining ICMR, in the northeastern region, in the Manipur, people were dying like flies with the mosquitoes. So we didn't know what kind of mosquito was there, because the mosquitoes every year, because of the global warming, they climb 1,000 feet. And so previously Northeast didn't have this. Bhutan now have malaria. Bhutan have dengue. The Nepal, the hilly regions have all these things. So we wanted to know that which mosquito species is the biter, so that we could target that mosquito species and kill them.
And you sacrificed your arm?
So they were allowed to bite, and then they bite you. You then catch which mosquito has got you, because they will have blood of yours. And so we saved them. We saved millions of millions. At that time, there was a health secretary who came, and he started weeping. He said that what did that I didn't do it. I was not ICMR. I was a professor in PGI. I had taken over ICMR.
Okay.
And he said that you are monsters. What did you do? You took the innocent people and the tribal people and let them be bitten by the mosquitoes. They might have got anemia. Of course, with the mosquito bite, nobody gets anemia. But he said that they might have got anemia, they might have got allergies. Go and see how you have affected them. But today's technology doesn't need that. So integrated vector control. One more thing I will say, that in the prevention, that with these days the GIS technologies, which controls 4 or 5 different weather conditions: the temperature, the rise of temperature, the vegetation, the rainfall, the humidity, type of the soil. All of these can then be calculated, and you can say that which places the mosquito are breeding more and where they will breed more. Because these days, because of the climate change, you never know when the summer will come, when the winter will come, when other things will come. But this forecasting does a very good thing. And then there is a new science which has come up, which are taught in Pune, even in Delhi. It's known as special geography. These guys, they took these, and this is a science of hydrology. They gather all these weather data, and they are the data cruncher. They can analyze these data, and some of these data are now collected through drones. And so these drones, they collect these data, and then they forecast. So I can tell you, Sonali, how many mosquitoes are in your house. This could be as precise as this.
That's
so
amazing.
These are the technologies which will prevent it.
If I might tell you something, I find what you've shared to be so informative. On the other side, before I came on to speak to you, I Googled onto this generative AI platform called ChatGPT, and I asked the AI to tell me a little bit about this disease. And all that could tell me is that it's not caused by witchcraft. You cannot detect the worm at in the daytime. You can only do it through a blood test at night, and that it is not genetic, and that you can also have men with giant testicles because there's also a lymph node there. And that was the genesis of what I learned on the
So,
internet, but
so,
you've
so
taught me
I,
so much
I,
more.
so I will want people not to go to Chat GPT. This actually tells you one thing was right, that they have got a periodicity, diurnal periodicity, and filarial worms are shed by the adult worms in the night time in most of the India. And Andaman Nicobar and others, they are both times. So ChatGPT was
So it
wrong.
wasn't correct, but
So it was
but it's
made,
also
and
not caused
and
by
and
witchcraft.
another thing, that you do a staining with that after processing the blood, and you can see the microfilariae. Adult filaria you don't see by that test. Adult filaria, you have to do an ultrasound and you have to do imaging, and then you see, and you see them moving also. So you can know with an ultrasound that whether the adult worms are dead or they are alive. And these days there are test systems which are known as RDTs that detect antigens and antibodies. So these RDTs can be found at any time. You need not have a nighttime blood. So there's a very big lesson for people not to get information through Googling,
And listen
or,
to the podcast instead, right?
and listen to those who really read literature. They analyze and can give their own opinion. Maybe their opinion sometimes may be wrong. There could be a second opinion, but at least you will get somewhere with that.
Right. Sir, Elephantiasis, it belongs to a larger group of diseases called neglected tropical diseases. And again, I was just talking to somebody I know from work, and I said, we're doing an episode on NTDs. And she said, well, if they're neglected, why do we need to care about them? So I really would like to ask you that, considering there's so many other diseases that are so common, are non-communicable diseases and cancers and so on. Why should
So,
we devote resources to NTDs at all?
Sonali, for the cancer, the largest fund goes for the cancer research and the cancer drug discovery and cancer drugs. But neglected tropical diseases are the group of diseases where the disease burden is in 90% in the underdeveloped, low income group or middle income group or poor country. And they only get 10% of the funds. Nobody makes any medicine out of that, because these medicines are don't earn money. So there is no drug discovery. Even there might be good diagnostics, but again there is no money on that. So they will not come to the developing countries to do that. So this is the problem in neglected tropical diseases, that the problem is 90-10, and it is now about 30-70. The aim was to gradually go on reducing it, so it got to 20-80, 30-70, like this. And whenever we put up we will reduce it by 2030, or we will do it by 2027. We have always set up targets for that. We have never been able to meet those targets because the resources, the partnerships, many of these works are done through partners, because communities and community participation is very, very important, and only the NGOs and partners can go there. They can see that that the insecticide spraying has been done properly. The persons who are suffering from them will go and take the medicine, and from where they will get the medicine. If the country has a program, when are those days, antiviral days, where you get the MDA or medicine? So all these knowledge they get only from the communities and the NGOs. So it is very, very important that we nurture these partnerships, in particularly for tropical. So there need to be fund for that. And finally, there has been two major efforts to get a special fund for entities. One was the London Declaration in 2012, where many people pledged money for entities, and the other one was Kigali Declaration. Kigali is a place in Rwanda. The two meetings which have taken place there. But what I am afraid of now, that the funding situation in the health globally is becoming a little dicey, because the CDC and the NIH, etc., who were a very major player in such things, they are not now part of the WHO system. So I'm really little worried that what will happen to these fundings. But European Union fundings are there. I'm one of the major program on Leishmaniasis, but it is going to settle down after the decisions are made in the US, that how their funding will flow. So then these international agencies will be active, but at the moment we need a special fund for this, and a majority of this, like filaria drug program runs through donation. So filaria drug program runs through donation, and these donations are gathered through Mexican donation system. So all the drugs like the DC, which we used to manufacture, and there was found that there was a dissociation problem, as Sri Lankan scientists identified that. So we are getting from ISI in Japan. The albendazole, which is because DC only works on the microfilarial worm. So adult filarial worm are relaxing in the lymph node, and after some time, they sometimes may get stunned and the fecundity may release, decrease, but after some time they start again producing. And so another drug was added, which is known as albendazole. And MDA multi-drug administration program was launched, and there were two antiviral days in this year, and they were giving these mass drug administration. Everyone was given these drugs, and so and there the albendazole came from the GSK. Now GSK has for India it is little better. GSK has set up a company in Nasik. So India doesn't need, India buys it, but for many years India was dependent on this donation. Then there was people who were getting these multiple times, maybe 10 years they got the MDA, and still there was filaria. So people were worried that what will happen. So there was in the Papua New Guinea and Haiti, there was Mr. Walsh in Papua New Guinea. We added a third drug, which was known as ivermectin. Ivermectin is made by Merck, and it is also a donation drug. So it was used for the onchocercosis. And in the initial stages, it was used for Indian lymphatic viruses. It didn't work. So the Walls, they added this ivermectin with these two drugs.
Right.
And lo and behold, that all the adult worms died, 99% of. So there's a huge news. So in India, there are regions which are accelerated regions, where the large number of MDA introduction hadn't caused any good over there. And there are areas where the MDA is still used, and it has worked in those areas. So gradually, these will be withdrawn. So one of the other things which have come up, which you will be glad to know, that normally the SRS data was collected for the district level data. Now the block level data is being collected, and in block level data, there is a problem that you will have to provide training and you will have to have a different data collection system. But this is the new thing, and there is a organization known as DNDI, Drug for Neglected Diseases Initiative. India also has an office. When I was in India, I had to set up this office. They are now trying to identify new drugs which will be specific for the adult microfilaria. We need to have drugs which will kill the adult microfilaria. Otherwise, they can live for several years, 4 or 5 years, and then they will start producing. So this is the issue.
Can I ask you something that's not related to NTDs right now? I might be wrong because, again, I'm relying on the internet for this. But according to the internet, you might well be the senior most medical specialist I've ever had on this podcast. Um, says that you're 83 right now. Am I
Yes,
getting your age
yes,
correct?
and I'm still active. I have,
And I wanted to know that. How are you so
I
active? What is your healthcare
so
take?
I have always been like, after I retired from ICMR, I opened a center for molecular medicine in India, and then I have set up 4 laboratories in India, which have a very strong research staff, and they work on different areas. Some work on oncology, some work on infectious disease, uh, leishmaniasis, and malaria, and filaria, and AMR, and some work on neuroscience and neurological diseases. So my idea is at this given moment to have very sophisticated laboratories where the new generations will come up, and I go on publishing. I publish around 8, 10 papers. They are my own papers. I don't take my younger generation papers. And recently, with the help of a consortium, including the NIMR director, Anup Panvikar, with the National Academy of Medical Sciences, we have now published a monograph on vector-borne diseases, the challenges and how do we deal with this. Has just been published. Finally, it is very important for the people to be linked with communities. So I have an office in global health strategies. I'm not their employee. I'm just an office, so that I can interact with the youngsters who are working there for advocacy and communication, as well as with the government. So whenever they want to pick up my brain and mind, they come to my office, and then I give them those
But
information.
how is your brain and mind still so healthy? I mean, you must be taking care of yourself in some way. So,
Yeah,
what is
so
your health approach?
so one of the things which works for me is I cannot sleep. So I get up at 3 o'clock in the morning every day, and I do a Jane Fonda exercise, advanced exercise for 1.5 hours. And after that, I have a solid 3 hours reading, which I do. And I used to be a professor in PGI and PGI Chandigarh, and we used to start our day at 8. So I'm the first in the office. I start at 7:30, and I'm first in the office, and I'm now sitting in my office in Gangaram and is doing this interview today. And my secretary, Preeti, who is in Global Health Strategy, she's an employee of Global Health Strategy. They allow me to her use for half an hour and an hour every day. She set up this meeting with you.
Lovely. Um, can I ask you why you chose to work with neglected tropical diseases? I
Now,
mean, you could have done something more glamorous, like,
you
cardiology and so on.
know, No, I have a large number of papers in cardiology also, but
Yes.
I started my career in infectious diseases. So that was my USP. And when in PGI, I had to take up the multidisciplinary department of experimental medicine, which was only doing cardiovascular research. Then I also adopted that. And then when I went with the health minister to New York for for the NCDs, and the cancer was a huge issue. So now very large part of my work is in cancer, because as you go, you need to put up a new challenges. But my passion for NTDs, because I was in the first NTD board, my passion for NTD has remained. So I put considerable number of days in creating new workforce, and new idea, new policy papers on NTD.
I just have one last thing. You've spent so many years in healthcare and, interacting with patients and seen all sorts of diseases and policy changes and so on. And what do you think about the health of the nation right now? Like, what does it make you feel?
You know, the our health system has improved a lot. We have been able to deal with a lot of NTDs effectively, like Daconculosis, which was known as the tapeworm, is gone now. When Daconculosis is gone, the yaws, which was another neglected disease, has gone. The trachoma has become, the ophthalmic trachoma has become almost not a public health danger anymore. The leishmaniasis is on the way, moving out. Five, malaria has drastically reduced. So our health system has been able to take care of many of them. But the problem is this, that whenever they get down, our system should go on doing surveillance, because these are cycles. Sometimes there are reservoirs, sometimes they're carrier, then these mosquitoes are there, the vectors are there. So they may come back with a vengeance after 4 years, 5 years. So
Yeah.
we should go on doing that. Like in leprosy, we had patches of leprosy, and we thought that we have won this thing, but leprosy is also a neglected topic.
Yeah.
But it came back in the patches, and in a large population it remained there. So this is something which we need to be vigilant for that, and we need to see that by any reason our funding is not getting reduced. We need to see that partnerships remain. We need to see that we are rooted with the communities. Like the community major problem in anti-filarial drugs, to really the children are the vulnerable. To give the children these drugs, some of these drugs are harmful of drugs. You have to gulp so many drugs together, and people, they don't like to do that. So there is a acceptability issue, which was 30-40%. We have to, after the campaign, we could bring the acceptability issue to about 70%, but we should have a much more thing. With a GPS, we should be able to, with these smart cameras, while we are giving it, we might see that they have taken it. So we can take a photograph, put it in the cloud. And if they have moved in the second round somewhere, we should be able to reach them there, because we have a large migratory population. The another very major problem in our country is this, that we have around 300 million guys who can afford anything in the world. Anywhere they can buy the medicines, their surgeries, anything they can. Then there are another 200, 300 million who, with little help from the government, and that government is providing now, and some insurance as another thing. Then there are 600 million guys who have nothing. So India is now maybe a developing country, but we need to bridge this gap that this is a disease of poverty. So some or other in the SDGs, where the poverty alleviation is also a program and the government has also program, we need to bridge that gap as quickly as possible to win over these diseases. We should be able to reach them. They should know where to go for their drugs. They should know that these drugs are provided free. They should know that it is their rights that their places are receive the annual spraying. They should know that their government for some entities provides incentives, like it provides you houses for the musahars. They provide the painting of the houses for the Musa. They provide drugs if you come for the treatment. They provide money if you come for the treatment. So government is doing a huge number of things, but some of these guys, like some of the Musas, they don't watch TV, they don't read newspapers, they don't have telephones, and they don't understand the language which me and Sonali you are talking to them. So for these, we need a different intervention. I had a friend, his name was Andre Quadros. He was a music teacher. And we started getting to these people with music. We did two programs, one in Gujarat and one in Pondicherry. And he was a Goanese who was a music teacher in Boston, and it has such a remarkable effect. Almost everyone knew right from the children and above that what is the disease, what actually causes it. This could be defeated. They knew this could be defeated. They knew they need to have some good healthy diet, which is their own kind of a diet which they take, and they also so they can build up the nutrition, and they also knew from where to go and they will get the drug and the incentivation. So this is where we need to. So anyone, your neighbor is important. Anyone in the community is important.
Yes, I think, just talking about it on platforms like this also raises awareness. So thank you so much for all your details and experiences and your wisdom. So thank you, sir.
Thank you, Sonali. It has been pleasure talking to you.
Just before I, decided to do this episode with Dr. Ganguly, I met with an NGO who works with elephantiasis patients. And, I heard the most beautiful story. It's a very short story, and I'll quickly share it, of a man in Uttar Pradesh who always thought that his disease, and he had giant swollen up legs, was genetic, that his father had given it to him. Because that was the myth circulated in the society that, it comes down from generations. He also thought it was because he'd done something wrong in his life. There's a whole moralistic aspect to it as well. And through this community outreach program, he was connected to other people from other villages who also have the same condition. And this NGO worker told me it was so beautiful to see them see another person with the same disease and realize that this is an infectious disease. I have done nothing wrong. God is not angry with me. And then they themselves became advocates for prevention of mosquitoes, and most importantly, they could share their problems between one another. And we do know that when you share a problem, it's halved in general, just to have that opportunity to talk. And it was a very beautiful story for me. So please let me know about your health stories and your health experiences. And if there's any specific health condition or a doctor you would like us to bring onto this series, you can write to us. We are available on pods@indiatoday.com, or you can message us on 8588 And if you've enjoyed this episode and Dr. Ganguly's wisdom has brought new awareness and new perspectives to your life, then please rate us. We are available on Apple, Spotify, YouTube, and the India Today website.